What is the waste and inappropriate service reduction? WISER. This is a new program by CMS, only in 5 states, to implement, to kind of test drive prior authorization on government Medicare. Now, you probably didn't know that government traditional Medicare A and B has had a few conditions that they have traditionally required prior authorization, which are part of the 17 procedures listed in this. Then they've expanded it slightly. So in the news, it makes it look like everybody on a Medicare supplement now has to go through the same red tape and hurdles to get a procedure that we have traditionally associated with Medicare Advantage. Now, Medicare Advantage has also been in the news because a lot of the largest carriers have pledged, promise is not enforceable, but they have come together with Dr. Oz and said, hey, we're going to make prior authorization streamlined, more simple, approve more procedures. And then, of course, legislation was already passed that would go into effect in January to make it digital and to increase the timelines and to make the companies give a reason when they deny. So that there's a lot going on in the prior authorization sphere on Medicare Advantage. And that's always been a sticking point on Medicare Advantage. It just is. It's an added bureaucratic step. You didn't have that if you had original government Medicare A and B and a Medicare supplement. Now we're flipping the script because CMS says, hey, that prior authorization thing might actually work and save money. So they are test driving it in 5 states. The states are Arizona, Oklahoma, Texas, Ohio, New Jersey, and Washington State. So right away, I got a comment from one of our clients in Washington State, and he said, I'm going through metastatic cancer treatments. Should I switch from my state of Washington? Should I move to another state so that I don't have to deal with this? And I can see when you're undergoing cancer treatments that, anything could rock the boat, could really impact you. But this is only for 17 procedures, and it should not impact this client at all going through cancer treatment. You can look up all the procedures, but I will tell you that there's some of the 5 procedures that have always been there. It's just agents and clients didn't know it was always there. The number one was upper eye blepharoplasty. Yes, I can actually pronounce that. To get an upper eyelid lift, Medicare would always pay for it if your ophthalmologist prescribes it, that you had the condition called ptosis, that your vision was being obscured, and I think it was like 15%. There was it runs in my family. So if you look at the Gordons, we have that. I've already had an upper eye lift, so you don't see it. I had to pay cash for it because I did not have enough of a sagging eyelid for it to qualify for insurance to pay for it. And that's where people kind of work the system. They work with their doctor and they say, well, she needs it because her vision's obscured to get Medicare to pay for it. So Medicare's been on to that. Anything that could be a cosmetic procedure, which I had it strictly for cosmetic reasons, if it could be for cosmetic reasons, they had a prior authorization built in. So upper eye blepharoplasty has been on that list for years. Same with varicose veins. Again, guilty as charged. I had varicose veins removed for cosmetic reasons. Now, other people in my family had to do it because of medical reasons, in which case insurance will pay for it and did pay for it. Mine was cosmetic. I paid for cash, but I couldn't work the system. Some doctors will fudge it a little bit to get it to pay for it. So that's been on the list. So how about a rhinoplasty? I have not had a rhinoplasty. Not guilty on that one. But rhinoplasty can be prescribed for medical reasons because it's obscuring your ability to breathe properly. But if it's strictly for cosmetic reasons, Medicare will not pay for it. So those procedures have always been on the list. Now, a lot of people are just now finding that out. Procedures that are on this list that people are not aware of: deep stem brain stimulation for Parkinson's disease. It's expensive. Skinned for wound care. Again, it's expensive. Bariatric surgery. So there's, I think, an epidural for long-term pain. You can Google the 17 procedures, but it's not everything. It's just these few things. Now, you're probably being a little bit cynical like I am, and you're saying, well, they're starting with these 17 things. Will they expand it? My thought, which is just my own speculation, is yes, they will expand it. The government's own data tells us that about 25% of all Medicare spending is wasteful, is fraudulent, is not needed. So if this pilot works, will it expand from those 5 states? Yes. Will it expand from those 17 procedures? Yes. Again, my opinion, but you probably feel the same way. But as it stands now, there's no need for your clients to panic. Again, if they are a Parkinson's patient or they're a pain patient, one of them I think is penile implants. That's on the list. Paniculectomy, removal of excess skin when you've had extreme weight loss, on the list. Cervical fusion with disc removal. Cardiac pacemaker. Cardiac defibrillator. So check out the list so that you're well-versed when you're talking to your clients this AEP if something could impact them if you're in one of those 5 states. Again, Arizona, Ohio, Oklahoma, Texas, New Jersey, and Washington State. If you're not in one of those states, you don't need to worry about it. We'll talk about your state in the future. If you have most of your clients on Medicare Advantage, again, more people are on Medicare Advantage now than are on traditional Medicare. For the first time, Medicare Advantage has exceeded it. Prior authorization is something you need to be explaining in detail because that is a pain point. Not when you're making the sale, when your clients are in their honeymoon and they're like, this is fantastic. It's 0 premium and I get money back, or I get an over-the-counter card for they're in their honeymoon. You need to tell them the good, the bad, and the ugly when you're with them making your presentation so that when they do have a delay getting their much-needed knee surgery, because of this prior authorization, extra bureaucratic layer that you already told them. And you told them, this is how it is. Your doctor will fight through it. It will either eventually get approved. We'll move you during the AEP to a new carrier, in which case you'll fight through it again, or you'll do the steps the carrier wants you to do, such as physical therapy for 6 months or getting steroid injections or whatever they want you to do before they will approve your much-needed knee surgery. So you got to tell them that when you're in the honeymoon period, because prior authorization is not going away no matter how much they talk about it going away and no matter how much they pledge. Now, you might have heard of a gold card. A gold card can be given to a doctor that says, hey, we're not even going to look at your prior authorization requests. We're going to grant them all because you have a proven track record of not doing wasteful, unnecessary procedures. So United Healthcare piloted this several years ago, so doctors in the United Healthcare network could get a gold card through United Healthcare to streamline their patients getting approved without those prior authorization delays. United Healthcare piloted that, and now the government, CMS, said, yeah, we're going to do the same thing in our 5 states for these 17 procedures. So if we can see your track record that you do not ever have your prior authorizations denied, we'll give you the gold card, and that will streamline access for procedures for your patients. So as a consumer, we want a patient with a gold card. There's no way for us to know who has a gold card. Wouldn't it be cool if it was like in the provider directory, if there was some place we could find that on their website? Because as a consumer looking for a new doctor, that's the doctor I want. So just know it exists. I have no idea how to access it. If you know anywhere that's publicly facing where we can see that data, please share it with me in the comments. I'd appreciate it. If you learned something today, please give me a subscribe. I will keep you up to date on this wonderful world of insurance.